clinic for today. May I confirm that you're Mr. Ali and you're 50 years old?
Yes, doctor.
Mr. Ali, today we are here to discuss about your health condition. And I'll be happy to examine you and address your concern. Is it okay for you?
Yes.
It came to my knowledge that you have some leg rash. Can you tell me more about it?
Yes. I have this lick rash, and this has started 1 year ago. This rash has been there for a long time, but last 2 weeks I have some ulcer in my shaft, and this ulcer now leaving, adding to this. The rash was there already.
I'm very sorry to see this, to hear this. Can you tell me, I can't see the rash now. Since how long it started this rash?
This rash have been there for 1 year, but the last 2 weeks there is this ulcer.
Started. And
Yes.
since 1 year, how did it start? Started suddenly?
Gradually, doctor.
Started gradually. Is it itchy?
There is some itchiness. Yes.
It was preceded by any insect bite,
No.
trauma.
No.
Okay. And you said it's itchy now. Is it oozing?
Oozing? The ulcer was oozing, yes.
Is it numby over it?
Yes.
Numbness also?
Yes.
And since the beginning of the rash till now, it is the same or got it changed?
The ulcer started to heal.
Yeah. And what about the rash, which started since 1 week?
It's the same.
1 week.
The 1 year.
It, it is the same.
Yes.
Okay. And with this rash, do you have pain,
Pain, I have numbness, doctor.
numbness? Is it in the foot or over the rash itself?
The numbness is in my bilateral feet and
In your butt?
my bilateral legs also.
Okay. Is there anywhere else you have other the same rash?
Rash, no, only my feet.
Did this rash increase with any sun exposure,
No.
alcohol,
No.
trauma?
No.
May I ask, did you ever diagnose with any health condition?
Yes, I have been diagnosed with diabetes and hypertension for the last 20 years.
Okay. And may I know what medication you're taking?
Yes, I'm taking insulin mixed for diabetes, and I'm taking lisinopril for hypertension.
Okay. May I ask what is the doses you are taking?
I'm taking insulin mixed 40 units in the morning and 20 units at night.
Okay. And did you change the dose recently?
Yes, the doses increased recently.
And you're complying to the medicine?
Yes,
May I ask what was the last time you checked the 3 months test HbA1c?
it is 9.
It is 9. Okay. And you're following a healthy lifestyle in the term of food and exercise, Mr. Ali?
Yes, doctor, I'm trying my best. Yes.
Okay. And do you have any eye problem as well?
Yes, I have blurring of vision.
Since how long?
This has been there for a long time now.
Okay. Did you seek medical advice?
Yes, I seek medical advice 1 year ago, and the doctor referred me to do laser photocoagulation.
Okay. Did you have any stroke,
Stroke? No.
chest pain?
No.
Okay. Do you have any water work change in the term of is it frothy?
Yes, my water work is increased amount, and it is, yes, it's frothy.
In term of amount, it increased?
Yes, the amount is increased.
Okay, I'm sorry for this. Any dizziness in standing position?
Yes.
Uh-huh. This is since 1 year also.
No, this has been there for a long time now.
Any fullness after having meal?
Yes.
Any feeling sick or throwing up?
No.
Any alteration of your bowel habit?
I have attacks of loose motion, sometime hard motion.
Okay. Is it related to any specific type of food like pasta?
No, no.
Bread. Okay.
No.
So ask a very private question. Do you have any problem in the intimate relationship?
Yes.
I'm sorry for this. And when you walk, do you get pain in your foot?
My foot is numby. I can feel that I'm walking on a cotton surface. I can't feel
Okay.
the
Okay.
ground.
Okay, but you don't have pain when you walk.
At first, it was like pain, but now it's more like numbness. I can't feel my feet at all.
Okay. And did you ever had any symptoms of sweating, hunger, pain, with shaking of hands together?
Yes, I have this multiple times.
What was the last time?
It was 2 days ago because I took larger insulin dose.
May I ask you why you took larger insulin dose?
Because I had some street food, so I tried to compensate by taking
Mm.
extra insulin units.
Mr. Ali, I would like to advise you against increasing the dose without checking your blood sugar, since it can be harmful. Do you drive, Mr. Ali?
Yes.
I would like to advise you also to stop driving till we sort it out. Is it
Okay.
okay?
Yes.
Okay, Mr. Ali, may I ask you, apart from these two medication, do you take any other medicine?
No, no,
Any other health condition?
no,
Any over-counter medicine?
no,
Any illicit drugs?
no.
Any family history of similar condition?
Yes. My mother and father are also diabetic.
Okay, any family history of sudden cardiac death?
No.
What do you do for living?
I'm early retired doctor.
And how what's happening with you affect your job and daily activity?
Yes, I couldn't continue my work because of um, lower limb. I can't move probably anymore. I have multiple
Um,
falls.
I will include our social health care worker who can help you in this regard. Mr. Ali, any hospital admission?
No,
Any sharing needles?
no,
Tattooing?
no.
Do you smoke?
Yes,
Okay. How many cigarettes?
maybe 4 to 5 cigarettes per day.
Would like to advise you also to quit smoking and it can be harmful. Do you drink alcohol?
Occasionally, doctor.
Mr. Ali, do you have any high body temperature?
No.
Any weight change?
Weight change? No.
Any lumps and bumps?
No. كده السبع دقايق
With a
خلص.
breath?
Yes. With the preferences? No.
Okay. May I examine you?
Yes, please. What do you want to examine?
I need vital signs of the patient, blood pressure, sitting and standing.
Okay, there is postural hypotension. Other vitals is okay.
I need to examine the leg.
Examine.
First, I need to look for the pulse.
Okay. There is no palpable pulse could be appreciated.
Then I will go for posterior tibial.
Okay. Not felt.
Then I then I will go for the popliteal.
Popliteal felt.
Okay. Then I would like to offer brachial brachial
Ankle brachial index.
ankle brachial index at this point. Okay.
Mhm.
I
Okay.
need to examine the peripheral neuropathy for by pin prick and by tuning fork.
Okay. So the vibration sensation is lost up to anterior superior iliac spine, and there is a high stock distribution of peripheral neuropathy of all modalities.
Up to the knee.
Yes,
Okay. Then I need to examine the ulcer. Is it painful?
the ulcer is painless.
I need to see whether there is any ulcers in the foot, any fungal infection, any charcot joint,
No.
and I need to ask the patient to walk.
Yes, the patient can walk, but he can't stand. He is swaying, so you need to protect the patient.
Okay. Then I need to examine. I need to examine the patient for fundus examination.
No need, doctor.
I need to do abdominal examination for any palpable mass, for any liver, uh, for any tenderness.
Okay, no palpable mass.
Okay, and then I need to examine the cardiovascular system of the patient.
Okay, cardiovascular is okay.
Okay. May I ask you what is your concern, Mr. Ali?
Anything else in the examination? You still have time, and you didn't complete the diabetic examination.
Diabetic examination. I need to see the site of injection.
Yes. Yes, you need to search for site of injection, and if any devices is there. Okay, site of injection, there is some lipodystrophy could be appreciated in the abdomen.
Okay.
Okay,
Okay.
what else in the diabetes examination?
Um, Blood pressure setting and standing, fundoscope, cardiovascular, abdomen,
Okay,
peripheral valve,
okay. What
nerve.
about the lower limb? The lower limb, you need to do inspection, palpation, and
I,
neurological examination. Did you check for the temperature change?
okay. Temperature changes. Okay. Is it any temperature change?
No.
Okay. Mr. Ali, may I ask you what's your concern?
My concern about this skin rash. Why it's there? It is not going away. And about the ulcer, why I have recurrent ulcers in my legs?
Yeah, your concern is very valid, Mr. Ali. I think after I spoke to you and examining you, that you have, because of this rash is, we call in medicine, diabetic dermopathy. It is one of the skin lesion which happen due to having blood sugar. And this ulcer, why it's not healing? I think because of long-standing diabetes, you have peripheral artery disease, where there is a reduce of the blood supply to your limbs and leg, and this definitely will affect the healing of your ulcer. So what we need to do now, we need to do some imaging for you, measuring the amount of the blood going to your limb, and we need to do some blood test. Um, we need to make a team from the gland doctor and limbs doctor and vessel doctor, vascular doctor, and we will run those tests and imaging, and we'll come back to you with the results. Do you have any other concern?
No. Now discussion with the examiner. Present your positive finding, please. Diagnosis and differential diagnosis.
Mr. Ali, 40 years or 50 years old, who presented with some skin lesion as well as ulcer, which is not healing, on background of being diabetes since 20 years, hypertensive with uncontrolled diabetes, is showing most of the complication of diabetes in the term of a microvascular complication, diabetic retinopathy, diabetic nephropathy, autonomic neuropathy, as well as peripheral vascular disease. So on examination, he got also some hypoglycemia. On examination, the pulse, I couldn't feel it up to the popliteal, and he's having ulcer, which is painless. I couldn't appreciate any infection. The all modalities of sensation is lost in stocking, high stocking pattern, and the Romberg's is positive in his
Did you do the
condition.
Romberg's test?
Yes.
You woke
What
the
do we do?
patient, but you didn't ask for Romberg.
Oh, okay. Mhm.
Okay, continue, doctor.
So my diagnosis, Mr. Ali, is having peripheral vascular disease with ischemic ulcer.
Okay, what is the cause of this skin rash?
Can be diabetic dermopathy,
Okay,
can be can be other skin infection which is common in diabetes,
like what?
like fungal infection, tinea angular. However, this is not the shape of tinea.
Yes.
Uh, can be bioderma gangrenosum. Can
Okay,
be microbiosis lipotica diabeticorum.
okay,
Um,
okay. Anything else?
diabetic dermopathy, fungal infection, necrosis, diabetic dermal gangrionism. And
Okay. Anything else rather than diabetes could result in same rash? So the rash is in the on the shaft of the tibia. What could cause the ulcer in this place?
erythema nodosum.
Less likely. You mentioned about
What is
doing ankle brachial index. You suspecting peripheral vascular disease?
أيوة ischemic ulcer,
Okay, could be ischemic ulcer. What other ulcers could result in same picture?
venous ulcer, but usually it would be in the medial side.
Okay, okay. What others?
Ischemic ulcer is unlikely. Neuropathic ulcer is unlikely, as usually it will be in the bottom of the feet.
Okay, very good. What else?
Maybe some sort of infection which got ulcerated.
Okay, what else?
Mm,
Could be traumatic.
could be traumatic,
Could
yeah.
be traumatic.
Mm,
Could be malignant. Could be bioderma gangliosum. All of this will cause an ulcer in this place. Okay,
mm.
so how would you like to manage this patient?
This patient he need multidisciplinary team from endocrinologist and vascular surgeon and vascular doctor and nephrologist, cardiologist. We need to do ultrasound arterial Doppler. We need also to assess the patency of the arteries, and we need also to check for the diabetes, HbA1c, blood sugar, kidney function, renal function, and protein urine creatinine ratio. We need also to screen him against complication of diabetes in terms of coronary cardiac coronary angio. We need also to do GIT scintigraphy for the GIT gastroparesis. We need also to
Okay, what about the lower limbs? How would you like to proceed? Is there any weakness there?
I didn't examine for weakness. Mm,
Okay, okay. So, how would you like to investigate for peripheral vascular disease other than Doppler?
uh, ankle brachial index,
Other than this, other imaging
uh,
modalities?
apart from ultrasound Doppler,
Yes. Venogram,
some are.
maybe? Do you want to do angiography for this patient?
Yes, yes.
Okay,
And I need nerve conduction test also.
okay, okay. So, what's the management or the treatment of this skin rash or this condition?
The management, if it is ischemic, we need to do some angioplasty, or we need to do put a stent, or we need also to control his blood sugar, as unlikely this ulcer will heal without improving the blood supply.
Okay. What else?
And if it is infection, diabetic dermopathy, mm, I really am not sure about diabetic dermopathy.
You need to control the blood sugar to
Mhm.
prevent further skin damage. Okay, thank you, doctor.